I'm going
Thank
to,
you.
then it's possible. Welcome. I'm going to start recording.
Okay.
Yeah. And share. Okay. Where is, so please feel free to start.
Hi, Mello. I'm the Dean of Research and Graduate Studies at ESPM. I'm glad to have you here. Thank you, Mário, for organizing this wonderful panel. And thank you, Jen, and sorry, I lost your names. Thank you all for accepting to stay with us during this panel. Thank you.
Okay. So just to add, we are very delighted that we have two distinguished guests here, international guests, Professor Phillip LeBel, yeah, and Professor Fang Wan. As I mentioned, let me see. Ooh, sometimes some. This is we are going to have this webinar for discussing, I think, these points for different perspectives. Phillip LeBel, it's economist, and Fang, it's work more in terms of marketing. Our school, actually, ESPM, is known more from the market area. So I think that's it's good to have this kind of perspectives, yeah. As I mentioned, it's all of you, the audience. I think that we have already more than 20 people here from different countries. Actually, we have 100 subscription for this webinar from 11, 12 different countries. Hope that it's going to be well. So later we can also share the web link so you can see watch the video again, so watch the webinar again, yeah. So the moderators, actually, Professor Cristina Helena Pinto, that is our dean from our graduate programs here in the ESPM, that we have master and PhD programs in communication and also in management. That this part of the management is my area. Yeah, so I'm here from the Professional International Business. So we work a lot of things related to internationalization, franchise internationalization, franchise of multinational companies, Brazilian companies, also international marketing. That is our core, actually. So we have many professors in this area. I want to give a special thanks. Jay already connect with us. He's not with the video, but I show his picture here. Yeah, he's the president of the Academy Global Business Research and Practice, the former SGBD, the Society for Global Business Economic Development. So I really thank you, Jay, for connecting all these professors, Professor Phillip and Fang, because they are also member of this AGBRP, and I'm also a member. So this was our conference that we did last year at the ESPM. That was the 16th SGBD conference. Now we are going to have the 17th, yeah, international conference. Will be in India. So later, Jay also can, if you want to say something about that, because most probably also going to be online during. Yeah, Jay,
Thank you, Mario, and you yourself, ESPM will be on board. It will be all online, and so
yeah,
we will do our best to connect.
Thank you.
Okay.
Yeah, and as I mentioned, our panelists, yeah, you're going to present. So first is Professor Phillip LeBel. He's Emeritus Professor at Montclair State University in the School of Business. He's an economist, yeah. So it's, as he mentioned earlier, just a few minutes ago, he's have this perspective of economists who work with all the basically developing countries like Latin America, and also something like most of Africa, I think. Since most of the projects is related to the World Bank, UNESCO. So this macro perspective, I think that is really good kind of perspective to have from this webinar. And Professor Fang Wan from University of Manitoba, Canada. She's a Chinese. Yeah, she is quite good in terms of presentation. For the we met for the first time, I think 4 years ago, as I mentioned, in Nanjing. So she has this perspective also from Canada and also from China. So I think that's bringing these two perspectives related to consumer and related to companies. I think that will be also a good add for our panel. Yeah. So not going to have so much words about this. So let's start. Yeah, I think the most important thing is to have this discussion. I think you have a good audience here, and then to share. I think that we start with Philip, that have around 15 minutes to present, and then I give the space to Fang to give her perspective. Okay. So I'm going to stop the sharing my here. Then Philip, you can share your screen and your presentation. Thank you very much, Philip and Fang, and again to contribute to this discussion that is quite important. Yeah, ESPN are doing a lot of things in terms of discussion about this impact of COVID-19, but mostly is in Portuguese. It's the first one that we are doing in English, giving these perspectives that come from international audience. I think that is good for us to hear your perspective in terms of this impact of COVID-19. Philip, yeah, can you share your screen?
Yes. Here we go.
And you can, so the presentation is yours, so please feel free to.
First of all, thank you, Cristina, Mario, our host in Brazil for this. Thank you, Jay, for inviting me to do this. I'm pleased to have met Fang and a number of others who have been involved with this conference activity. So it's a pleasure to be with you. Let me say that I've been tracking the coronavirus since March. When I say tracking, there is an international website, I think Johns Hopkins University provided some of that. And so what I've been doing is I've been tracking the number of cases, the number of fatalities, the fatality rate, the growth rate of fatalities, the growth rate of cases, just to get a sense of the magnitude of the coronavirus in the United States as well as in other countries. And so it's not something I've been sharing with a lot of people. I have some friends I've done that with, and I haven't done anything professionally about it. But let me pull up my little presentation and give you an idea of what I have in mind for this. This is a, let's see if I can get this to work right. A series of slides. So I'll start off by saying a few observations about what we are looking at in terms of this virus. And try to get that within the screen. I'm going to try to adjust the resolution down to 90%.
Yeah, you can.
Yeah, can everybody see it that way? I hope you can. First of all, we tend to respond emotionally to events like this. We can even respond emotionally to economic events. We're watching the stock markets around the world take a downward spiral. You're seeing economic reports that the US is facing a contraction in the last quarter, maybe around 6% in economic activity. So we see a kind of reverberation from this. But let me just first of all focus initially on the virus itself. And I would say that testing rates have been highly uneven, and it makes it difficult to draw comparisons. We don't have universal testing, even by sample or inclusively on a census basis around the world. And it's kind of hard to keep track of it. Case and fatality rates, they don't include asymptotic contagion and non-hospitalization patterns. What we have are people who are actually carriers of this virus, but they don't have any evident signs. And so we don't know whether we should be concerned or not. What we're tending to do is just track the obvious. People who are going to a hospital or they've gone to a doctor and they've been diagnosed as such, but that's not reflecting the full picture. So transparency in reporting cases has also been uneven. As a result, confinement measures, they're no substitute for tracing and the eventual vaccines we all hope to discover in the process. So right now there's a lot of debate about, well, who knew what, how soon did they know it? And all of you may have followed the response in the United States of the Trump administration, which initially was quite dismissive of this. They didn't think it was a serious problem. Went back to February. We now know that in Wuhan, in Wuhan province in China, this was first diagnosed actually by a Chinese physician back in December, as early as December, and who eventually passed away from that virus. So what we're looking at is a kind of an opaque world in which we don't have, if you will, full transparency that we all need to have in order to make some sense of this. So the economic costs may be just as catastrophic in the short run as the health costs. I just mentioned that. And I'd get to the main point, which is global cooperation in a transparent and accountable way. It's an essential dimension of any long-term solution to manage this pandemic. We're living in a time before this pandemic took place of populist nationalism. People are retreating behind national borders, and we have an undermining of international institutions that otherwise would be involved in major cooperation. That I think would strike at the heart of what Jay's organization has been about over the years, in which I've been a proud supporter. So let's just look at some of the trends. These are the trends in the pandemic. I put Brazil on the top here because I knew that Mario had invited me for this. What I would try to do with some of these is, and this did not do that, is I would use simple trend analysis, and I would take it up to third, fourth, and fifth order to see if it would actually peak at some point. And it was kind of hard to do that. Well, we know that in Brazil's case, they had difficulties, first of all, recognizing the seriousness of this, just as in America, the Trump administration had trouble recognizing it early on, and therefore to take countermeasures. Well, what do we have here in terms of some of the other places? In Russia, a country that initially had very slow, you see that you begin to see some flex taking place. That's the flattening out everybody's looking at. In India, still a rising curve. So these are just some comparisons of cases now. How would you then compare this when I say that cases alone are forcing us to act? Another way to look at this is cases per million population. That's the incidence of the coronavirus. And I look at Ecuador, for example, and you would be frightened when you look at that trend in terms of million population. Brazil looks like it's less serious, even though Brazil has more coronavirus cases than Ecuador. Moving further on, cases per million in Asia. This is in India. I did see some peak in this, and it said, okay, around this time we would begin to see some peaking in Asia. I'm just using India as an example. So what we're all looking for is, when do you see a turning point? In Latin America, same kind of thing. For Brazil or for Ecuador, when do you see that beginning to turn around? And of course, that would give you some idea of when to do it, when to open up the economy. Now, here are some fatality rate measures. In Indonesia has one of the highest rates, and yet when people talk about Asia, your first inclination is to say, well, what are the most populous countries? You're going to look at China, and then you're going to look at India. And so Indonesia, which has a higher fatality rate, you might say, well, we're not going to pay attention to it because it's not as populous as some of these other countries that we're looking at in a region. And again, that's where our psychology, our perception becomes somewhat limited. Again, looking at the number of cases per million, Luxembourg in Europe has one of the highest. Is anybody screaming about what's going on in Luxembourg? No, they're looking at what's going on in the larger population countries such as Germany, France, England, and so forth before they provide some response. Germany has a low one, which provides a great deal of interest as to why they were so successful. We'll get to that. We look at fatality rates. Belgium has one of the highest fatality rates of cases. How do I calculate the fatality rate? It's the number of deaths on the same day that it reports the number of cases. You have a lagged effect there, which is to say, if you had measures of confinement, you would have some adjustment that would take place for that. But that's just a crude measure of a fatality rate. Obviously, Belgium is way higher than the world trend that we see and may slowly begin to peak. Let me look at these economic losses. They're steep, but they may be transitory. Equity markets have dropped in value by the trillions of dollars. We haven't seen anything like that in some time. Bankruptcies and industry consolidation rates, they're accelerating. Unemployment rates are rapidly reaching double-digit levels. I don't have numbers to share with you about the United States. I would not be surprised to see that the unemployment rate in the United States in this last quarter would jump up to something like 15%. You know, it's steeper than what we saw in 2008. When those numbers, even on a lag basis, take place, governments, as you can see, around the world are scrambling to inject stimulus measures. They're trying to maintain liquidity in financial markets and to keep firms afloat and not going under. So they're injecting stimulus measures. The United States has already passed over $1 trillion worth of spending designed to keep financial institutions in a lending process and to keep businesses in a liquid position. Supply chain logistics. They want sustained globalization. You know, when we talk about globalization, we're talking about international linkages that exist between a point of delivery of an endpoint as opposed to the primary source where something is produced. Well, this is now being disrupted, and it's being magnified by this pre-pandemic tendency to promote nationalist and protectionist policies. And so there was already that threat prior to this pandemic taking place. These economic losses may produce permanent structural change. The shift to digital commerce is likely to accelerate. Already in the United States, we had what we call shopping malls on a large scale, closing down their operations, closing down the number of branches. Amazon has become the big player in delivery of all kinds of services in this process. That is likely to continue in the future. Educational institutions, they're going to become more integrated with online learning and also school to work connections, internships and things of that sort. So the gig economy is likely to claim a higher share of employment in the future. That is to say, people doing short-term consultative work, task-specific, but it's not a long-term career. The idea that you're going to work for a corporation over the rest of your working life is going to become less and less significant. Income equality may become greater as educational and skills inequality become more pronounced unless otherwise mediated. Those who are looking at and hurting the most are the less well-educated, who are not only less well-informed about the pandemic, but also have less skills that they can market in the marketplace. They have lower rates of access to the internet, to the latest applications, and as a result of that, that tends to accelerate inequality beyond what was already there, and it was serious enough already. Social dimensions. Countries that built wealth through export-led economic growth now face the prospect of social unrest and possible political upheaval as globalization recedes. Let's just take the case of China. China, for the first time, its vast middle class that was created through the policies of opening up and developing an export-led economy, these people are being very greatly affected with these markets now closing down. And so the Chinese GDP, I saw a number that said it contracted by 6-point-something% the last quarter. So that creates, if you will, political tensions in the sense that, and this isn't true for Xi Jinping saying, we have a social compact here. The social compact is what? Do not question the political environment as long as we deliver what? Economic prosperity. Well, now China is suffering from that. It's not getting the economic prosperity. Now, there are some people that I consider to be extremists who say, well, China is engaged in a plot to destroy the rest of the world. Let me stand here clearly and unequivocally. China had no intention of this virus destroying the very markets on which its wealth depended, and people should never lose track of that. So the Chinese are as upset with this as anybody else. Okay, given that, what we see now is racial and ethnic hatred. They're a growing part of scapegoating trend of nationalist protectionist policies, and they are toxic to long-term prosperity. What we see is a blame game that goes on, and we see it manifest in what Donald Trump tends to send on a regular basis, but he's far from alone. Worse, quack medicine and quick fixes, they're no substitute for science-based public policy. So we have political pronouncements by people who are not informed, who are not able to give you, if you will, the best advice, not relying on the science-based professionals for those conditions. So over the long term, measures over the long term, global cooperation in managing the coronavirus and economic restoration is essential. We should not debase international institutions. We should be strengthening them at this time. Public multilateral institutions, they're an essential key to restoring economic and physical health. Transnational research collaboration to anticipate future pandemics is essential and cannot be undertaken alone. I know that in Wuhan, for example, there already was international collaboration with the head of the Max Planck Institute. There was a French doctor, Emmanuel Charpentier. She was working in that area. And there also were French nationals who were involved in it. Finally, measures to expand trade and investment need positive leadership to counter the tendency to engage in narrow protectionism. So that's the challenge that we face as we talk about going back and opening up our economies once again. So that is my presentation. I think I am under my time limit. I had some data to show here, which I will hold off on beyond what I already showed you, and I thank you for your patience. I'll stop by sharing.
Okay, yeah, thank you very much, Philip, to share your thoughts about this. And we are going to continue giving the words to Fang, and then we'll open the discussion. I think it will be fine. Yeah, thank you very much.
Okay, good job.
Yeah, Fang.
Okay, good morning. And also I want to thank Jay, Cristina, and also Mário. Good to see you after so many years again. Even though I've never been to Brazil, I told my friends that my webinar is in Brazil virtually. So it's very nice to finally associate with ESPM, and I did my share of promotion with my Chinese audience. I have my own social media platform. I have my book club. I have a virtual global book club, so connect to many people. So and also talk about online. One time, my live broadcast had 1.4 million people tuned in. So as a marketing professor, I guess I want to execute what I teach stuff on social media. I want to share the screen now, but most importantly, I want you to pay attention to the difference between the marketing professor and the econ professor. So I think it's a perfect compliment in the way that we really complement each other's style. Philip, really enjoyed your presentation. I was wondering the other day whether, you know, we're going to have some overlap. Looks like we may have some similar views or dissimilar, but a different style. To me, COVID-19, as old as I am, it's I think the right analogy is really, it's a war. It's a war without gunpowder, because you never see, you know, everything is shut down, and then most importantly, this is an enemy without a face. It's a ghost, very sneaky, very foxy. I think I actually attended a university in Wuhan, many friends in Wuhan. So when we were tracking what's happening there from day one, my heart was always very heavy. And the Chinese New Year is in February, 1 month. And the whole year from January even to now, my heart was never lightened. So it was a very long enduring process. That's why compared to, I just want to mention that a lot of Chinese, because they're so tuned in social media, they know the nature of the virus. For example, you can have the virus without a symptom. For example, can be airborne. We know many truths about the virus, so that our preventive measure by Chinese, overseas Chinese, looks really crazy and radical. And I'm sure the overseas Chinese are the first batch who wear masks and send a scare signal to the rest. So it's a very interesting experience. I want to start with the new normal. And as Philip mentioned, this virus without vaccine, and we don't know how long, it never feels safe. So I think instead of thinking things will go back to normal, this is a new normal. I believe at the very beginning, Israeli editorial was talking about a mask can be fashion, and it is happening. This is NHL. My son yesterday wanted me to buy him this mask. He's a hockey player, and this is the queen. This is a new normal. I don't know what you're wearing under your shirt, but this is how we are these days. The Walmart, the South Bank, all the tops are sold out, a lot of them. But the not sold out items, actually, there is a lot of overstock, is actually the pants. And I just made a lot of purchase lately. I didn't buy any pants or skirts. I just want a shirt. So it's a new normal. This is my city. I will talk about Canada, Manitoba, Costco. Well, everything shut down, and Costco remains busy and busier. The average waiting time is 30 to 40 minutes. I was lucky that day, but this is the shortest line. And this is what it looks like. And this is going in, very few people. But look at out of stock. It's like a war zone. So a lot of great stuff, mostly gloves. Also is better, and we talk about hoarding. This is a new normal. These are poor hockey players. My son is one of them. Before the season, they didn't even have a group photo. So the moms make a group photo. This is, I don't know whether you watch the show by WHO about the One World Together. New normal, all the entertainers, you know, you can see this is how, this is more than 3 million. So some numbers here, but what's interesting, it's funny, related to all of them, China ranked number 10, Brazil and Canada. So I live in Canada, so I'm not giving you a talk to see the numbers here. But most importantly, I want to talk a little bit about where I am. So this is Canada. So I draw a circle. This is Manitoba. And this is our we started at the very beginning. This is our curve. The curve is not the gray area, is not the blue line. It actually is a black dotted line, which means Manitoba, our case confirmed, is no more than 260, okay? And has been staying flat for a while. And it's very interesting because the last time when I gave a talk, it was March 20th. It's the first announced date of the lockdown of the city, but today is April 30th, which means coming Monday, we're opening. So gradual opening. So it's really interesting. Within a month, every day, everything is going so fast. And when I think about a virus, I want to find a quote. I like what Einstein is saying. Adversity introduces a man to himself. I love this quote because for me, from a psychology, from international business, I want to see a bigger picture. And this is the framework I draw. I think the COVID-19 is almost like a mirror. And let us see a true self with several dimensions. And this is a framework I want to talk about today. Is I want to start with the government because from business perspective, I think we don't pay so much attention to the role of the government. In the public management, you know, people are talking so much about it, but now we understand it's a play a central role, the government and its leaders. And then we talk about how their policies are affecting the business society, but there is a very important piece. It doesn't matter it's a leader of the government or it doesn't matter it's a consumer of the society. We're all embedded in a culture. We're very different in our culture. Brazilian culture, different from Chinese culture, Japanese culture, American culture, Swedish culture. So I want to particularly talk about that piece as well. So I'm going to talk about the three parts of it. Now let's start with the government and leaders. I just want to, Philip is tracking this. This paper is actually from my colleagues in China, Nature. So this just published yesterday, talking about the geographical, the spatial spread and the temporal spread. This is China, the map. The red dot is Wuhan, the epicenter. You can see the color is very clear, is that virus is carried by people. When people travel, and this is why it's about proximity. So when you see the lighter color, it's further away from Wuhan. So that's how they travel, right? So that's why when we lock down, the reason we want to lock down people so people do not carry virus. So then this is also a graph from that Nature, the paper showing the temporal with time and also the spread. And they show a lot of the data here is to have a bigger picture of the speed of the spread and the region, how the physical distance is spread as well. Now, I want to talk about a few things in China that Western media and actually some experts really think they did a very good job, but also very controversial. One of them is about the tracking, the virus tracking app. So for example, you know, China is very digitalized. If you go to the train, whatever, you always need a phone. So if you have virus, they can track you that where you have been. So it's very digital. That's why they can find and trace these carrier and make them go to this. That's why it's very efficient in that way. But at the same time, people say the privacy. So some Western scholars are saying this is a abnormal time. You need to take extraordinary measures. So this is one of the comments as well. I also want to talk about going back to very different from the lockdown, we have Sweden. And recently Sweden comes to the picture because Sweden is very soft about how it's a citizen's right, how it's their job, it's their right to choose whether they want to do social distancing. Very laissez-faire, very loose kind of measure. And some people are saying compared to the neighbor, Sweden's death rate is much higher. And now when everybody trying to come back to economic opening, Sweden seems to have a upper hand because they're not having as much severe damage as well. So the reason I want to make the point about this is it looks like the government, the leaders have two kind of mental models. One I call the tight. I'm going to introduce this concept. Is a tight culture is really about very adhere to the norm. What is the right thing to do? And they're very religiously and very disciplined about these measures. And the loose culture is independent culture. and a lot of them really talking about my individual rights. It's very hard for them, and it doesn't feel right. So I want to say that herd immunity from Europe and Sweden is one of the now the representatives. You can see how, and then everybody fall in the middle. So the Chinese on the one side, and then you look at the Taiwan, the model of Taiwan and Japan, South Korea, they're not 100% lockdown, shutdown, and the virus is more in control. So it's very interesting here to see the speed of response as well. And also we talk about the government, what kind of aid. And one thing for sure, this is a big contest for all governments to invest in vaccine and medical research. And this is a time for all governments to really try to, in a way, to get back to the infrastructure, medical infrastructure, public safety, public health. And this is a perfect time really for them to reflect and heavily invest and because it really affects well-being. So this is one part. I don't want to give people a lot of data. We track that every day. I just want to share what I see. So the second part I want to talk about it is a culture. I want to introduce a very, my favorite scholar. She is now at Stanford, Michelle Gelfand. And her work about the tight culture and the loose culture is very interesting. Now we talk about at the individual level. And we know that in the tight culture, you know, wearing masks and social distance, stay at home, self-quarantine, very, very rigorously executed. For loose culture, I think it's very difficult. And I'll give you some snapshot. So here, you know, we talk about from very early on, these medical frontline workers in the US talking about stay at home, and you know, it's important. We still see on the left side, this is Los Angeles, you know, difficult, but this is Beijing in February, also when it's a peak time. So we can see that people have very different, and also wearing masks is important. On the left side is actually, I made a initiative, a petition, because I'm very bothered by the fact that a lot of people don't wear masks. With knowledge, and I know it's airborne, it's easy to get infected. So I aligned with a lot of my colleagues, and we write this for the provincial government. And this is in the middle, late March. And I think after 2 weeks, the masking is a necessity, is required. And you can see gradually. So there's interesting, these are the signals of these tight and looseness as well. I want to go back to the business part. I want to talk about two things here. I want to talk about the opportunity. I know it's very difficult for business, but at the same time, it is, a lot of them die, small business, a lot of them folded. But I really, really believe as well, the survival is the fittest, is really about that, the resilience and innovation. We ourselves, your business school is still functioning, my business school within 2 days, all go online. It's a testament of how fast we need to react and how we need to embrace this new normal. And to be honest, I myself have very good experience. Online teaching is because of a chat room. I don't know how our audience is using a chat room. My students, we use chat rooms so much while someone is presenting, and the discussion always go overtime, which is even more than normal because these kids are texting generation. So that's why I always send in 2 devices. One is the laptop. I constantly involved in the chat with them. So with business society, I want to talk about, for example, this one. I wrote a case on BYD. If you're interested, I can send you the case. And the BYD is a automaker. Now BYD is the #1 mask manufacturer, not only in China, but also in the world. And they produce 20 million masks a day. Okay, so this is how fast they're really. And also we talk about shutdown. Talk about a lot of newspaper, for example. Now talking about Adidas, and talk about Adidas lose so much money. 90% of the profit. We talk about a lot of close down. And also this is really times with this cover. This is a Chinese, like a Chinese Uber Eat, but it's called Meituan. And why this guy deserved to be on the cover. And this is our new normal. These delivery people, when shut down, when the world stands still, these are the people who actually help us maintain the life. And one of the small example is that, you know, there's a food industry, especially restaurants shut down. This is one of my students' family business running for 40 years, a Thai restaurant. And you can imagine it's devastating But what's interesting, I call it, name is Pad Thai. Why I call it revolution? Because I told her, I said, you should start digitalization right now, push all your clients into Instagram. So she become actually a celebrity locally because she packs so much food, giving to the frontline medical staff because they have nothing to eat. They're too busy, and they become celebrity. Not only that, they go to the Instagram, you can do this side, they started growing, and they started teaching and nurturing their customers to order on Instagram text message. And so now they're doing very well. So it's a very fast, but the question is how many people can do those fast? So there is a room for survival. And also from business side, what, from marketing perspective, what do we even say? So I love this article from LinkedIn by this professor, Dedesh Shees. I love the messages. I never quote someone so extensively because I enjoy his point about a lot of business, global giants, global business are not doing enough because the only way, we call it a compassionate capitalism, they have to show their responsibility. They have to use their global supply chain, use their reach, their marketing efforts, everything to really help. But the help is not as much, even though there is some. So one thing he said, in short, business really need to know how to scale up everything. In the private sector, can reach to India, to Africa, can reach the remote area that even local government cannot reach. And they are the people who actually should step up. So the author is criticizing, and I agree. I think the business is not doing enough, and this is one of my own. And also, one last point I want to make is, this is the Asper School, our school, and I want to, this is our LinkedIn, the giving. So it's the same thing that the community, our business community need help, they're folding up. So we deliver this virtual leadership series, no cost, because normally it costs a lot of money, within, and we're talking about how many sessions, 6 sessions, 100 per session, 600 seats within minutes and hours, within just a day or two, it just filled out like that. You can understand the demand. So I think as a business school, we really, it's time for us to give a lot of these free. And I'll give an example. This is marketing. This is Pearl Gamble gave all this. But this marketing from Manitoba gave 300 hours, I'm sorry, $3 million worth of the hours to local community. We have to stand together, stand strong. And lastly, I want to wrap with my presentation is about the psychology. Why we see so many other things happening. Very simple. When we have fear, we need for certainty. When we need for certainty, we become extremely risk averse. When we become so risk averse, what we do is that we believe in conspiracy theory. We try to blame other people. You know, we believe in one-sided information. We like to hoard stuff. We like to herd. We want to follow, you know, and all these, we become very competitive instead of collaborative because our survival instinct is triggered. So from Maslow, we are now dropping down to this lower tier of being. So we have to really ride against the tide, try to rise above that and be compassionate. And I think that's really the problem. So the social distancing is interesting because social distancing creates the trust issue. So if you're from the same family, you know, if a family of 5, or even from my best friend, so maybe it's a better. So geographical border, geographical boundary, this is why anti-global is making sense because social distancing make trust is contingent on the geography, on the physical distance. And not to say the COVID-19, I think Philip was talking about this anti-globalization, how long would it be? I'm not so sure. But one thing we do know is that economic dependency is not sustainable. Every country needs to look into this economic structure. Some industries, you just need to be more independent. And I think that's time to really reconsider this. And I want to go to the last point about where are we going? Is vaccine coming soon? And it looks like vaccine not going to be like in 6 months. The new normal is that maybe we'll live with this virus for a while. And when we now, Manitoba is opening up in this coming Monday, you're going to expect another spike, the second wave. And so the chief economist of CIBC of Canada had a speech the other day, and I agree with what he said. It's going to be zigzag. We'll have to get used to a zigzag. So when we go back to work, it will go up, and then we take some measures again, it will go down, and then go up again. And so is the cycle of economic, conditions as well. So it's not going to be straight. It's just like back and forth, back and forth. And I believe I agree with that. And also thinking about the different medicine, the hopes up, so hopes down. So it looks like a Gillette, the remdesivir is not really effective at all. And then Chinese at the beginning was also heavily invest and also want to believe it's in Harvard. We look at this, is fall going to be open? It looks like Harvard now announcing. So I think that's possible. And we look at their and the summer courses all online for us. And so we look at each other. We look at a lot of information here. So again, I'm not an economist that I track data, but I just want to share because of a time constraint. So Einstein is asked, adversity introduced a man to himself. And I want to end my talk by saying, we see a schizophrenic, two-sided of the human nature. We're very defensive. You can see it so much from Donald Trump, so many leaders, they made a mistake. They really missed the time window. They reacted too slowly, very defensive. Even though they're wrong, they're defensive. Wearing mask is important. The Canadian government, it took them a long time to finally admit that a mask is important, and because they're worried about the short supply of a medical mask, so they don't want the public to wear a mask, and it's not right. So very defensive, disillusioned, right? Selfish. All these countries waiting at the airport in China, trying to grab the mask. Americans grabbed the France supply. Israeli army has to go to Beijing airport to grab these medical supply. So we're talking about these selfish, and we're very vulnerable because yes, this is much higher death rate than the normal flu. And it's scary as well. We're very psychologically and physically, we're human, we're not a machine. We have AI, but we're not the AI ourselves. On the other hand, we see glimpse and hope and talking about proactive measures, a lot of company as well, volunteer. One thing made me cry over and over is the darkest hours in Wuhan, and all these delivery people and they really risk their life and do shopping for old people in New York. These top school from Harvard, from NYU, Columbia, the kids, their jobs are gone, so they create an app online to help older people free, help them to buy grocery, to drop them off. So the compassion, truthful, we are seeking for truth. What is the source? What is the source of the virus? And stop just doing all these conspiracy theory. What is happening? Can we prevent it from happening again? Resilience, because we're still surviving. And for education, I really think there's no more going back. It's going to be blended. And a lot of executive education, it's a no-brainer. The executives are so busy, can go to the hotel and just check in, they can watch the video. So meeting in face-to-face in the room is becoming a luxury version of these type of education. So anyway, I cannot be very comprehensive. That's not my forte. I just want to point out something I feel strong about. I was told originally 15 minutes, 10 minutes actually. So I hope I'm not going over time, and I can be connected on LinkedIn. This is my code. Thank you so much for the opportunity that we can share what we think. We're every day we're overwhelmed. My brain is going nuts because so much information. So that's from me. Thank you.
Thank you very much, Fang. And thank you very much, Philip. Yeah, I think that is a good kind of presentation that you done, because actually the world was not going to